This conference will now be recorded.
Okay, we are going to talk about preparation for MRCPI2 OB-GYN. So you should know that membership of the Royal College of Physicians of Ireland, this is an internationally recognized qualification, and this is a good qualification and it is accepted worldwide. So basically, it allows you to enter the higher specialty training, or you can go to subspecialty. And this degree is achieved through examination. So the most important part would be that you should follow the college website every now and then, especially because of this COVID virus pandemic, COVID-19 pandemic. Many changes have taken place, and they have led to several changes. Like the exam was already computer-based test, and but now it is available in certain locations, and then some of the candidates, they have been allowed to take exam from their home setting. So the college has sent directions to the people, and I hope we are trying to arrange everything in the perfect manner, because this exam has been delayed twice. First, it was supposed to take place on March 24th, then it was postponed to June, and then again it was postponed to September. Let's hope that they will be able to pull it off on September 9. Anyhow, whenever is the exam, preparation is going to be very important. It's quite difficult exam. People tend to underestimate it. This is not the case. This is an international exam, and just like any other international exam, you have to prepare very well for it. So basically, you should know that there is no part one for MRCPI. RCPI people, they have like general part one exam. You can take that exam, but if you directly want to go to the OB-GYN, then it is better that you should finish MRCOG part one, and then you should fulfill the criteria that you should have at least 2 years training in OB-GYN, and then you can apply for sitting part two. So, but I would say that you should try to take it once you have completed your training, because this exam is very practical, and at least you should be able to go through full OB-GYN, and you should be able to understand it. So for MRCPI2 written, there are certain exemptions. Like if you have MRCPI part 1, or you have MRCOG part 1, or you have MRACOG from Australia, or MRN, the ZCOG, this is from New Zealand part 1, or you have FCOG from South Africa, or you have completed FCPS part 1 and 2 from Pakistan. And then if you have done MD of the Malaysia, if you have done it after 2008, and you should have at least 2 years post registration training in recognized post. It can be in OB, it can be in gynae, but better if you have in both. So 1 year, preferable is that you should have spent 1 year in OB and 1 year in gynae. Regarding exam format, there are two parts of the exam. For the written part and for the OSCE part, they are still using the name MRCPI2 OB-GYN. So MRCPI part 2 written, it has 100 questions all in one paper. This is computer-based test, no negative marking, single best answer format is used, and all questions, they are equally weighed, and you should try to attempt all questions. The duration is 3 hours, and as you know, it is held twice every year. And the challenge with this exam is that very limited places, and you have to wait for a long time to take this exam. So this exam is very dynamic, very challenging, and your knowledge should be up to date. The college has written that they can give you, and they have not given precise guideline, but they're telling you that you have to have like very much updated information. This is your job to continue finding the best possibilities, and that then how you can maximize your chances. That is the point. Okay, so you have sent the application, you have been selected to take the exam, and now you're waiting for it, and you have received your ticket and everything. Then you should remember that how you are going to uh, attempt this exam. So study resources are very important. Single best answer is the format, and this is CBT, computer-based test. Exam calendar, you have to check periodically on the college website. And once you will pass the exam, then you will have to go for the OSCE, and we have different orientation plan for the OSCE people also. But the most important part is that you have to get a place on the exam, so apply very early. And now in the MRCPI group with me, I think 3 candidates are going to take this time, and others, their exam has been postponed to March, but this advice is equally important to them. Regarding the study resources, the curriculum, it is based, this is a misconcept that it's an easy exam. No, it's not an easy exam. It's quite challenging. College has given you full list of, if you follow this link, they have given you the full list of the study resources. So it has a generic component, and then it has a specialty section also. So you should have, like, it is based on the basic specialist training in OB/GYN curriculum. It is very much similar to the MRCOG, and the only difference is that we have to include Irish guidelines. And there are 43 to 47 guidelines, because some of them are interim guidelines, and which are available free of cost on the college website. And nowadays they are updating, so we have to take some of the RCOG guidelines. Content is almost the same, and some topics are not covered in these guidelines, so we are trying to cover them from other resources like strategy. And then we have to do the dogs also for the last 3 years, and we are going to do the green top guidelines and the nice guidelines, and then some of the scientific impact papers, especially the new one. Then RCOG consent advice, then clinical governance advice, good practice guidelines, and best practice papers. So in our online courses, we have taken out information from all of these resources. Like the people who have attended the courses, they know that we have taken out a lot of stuff from these resources. So the college guidelines, they are equally important like that. And you can see that every single topic you will find here, it's a misconcept that MRCPI is an easy exam. It's not an easy exam. Especially if you will ask the people who have taken it, they will tell you that the exam was quite challenging, very much updated, and you were required to know everything that you have to do for the RCOG exam, for the MRCOG or American boards or FCPS or any exam for that matter, Sudanese MD or the this Egyptian MD. So all of these things are important. So once you are going to take the exam, you will find that they have given you one candidate number and one is the exam number. So when you are in the center, you are supposed to enter the exam number. And now you are taking from your home. So advice would be that stay in a closed place. They have very much updated software. Don't look right and left, and just take the exam under exam conditions as they have given you the directions. Sit in a good corner, isolated corner. Your internet connection should be of high speed. It should be good and reliable. And those who are taking from the Western world, like from the Ireland, they will not have these other problems. But the people who are attempting from other locations, they have to be very careful. They should think about any accidents or hazards, and they should inform the college in advance that these are my circumstances. So you have gone to the exam, you have entered your exam number, and then the questions, they will open up. The format is single best answer. The single best answer, as you know, here the point is that they will, all single best answers, they will have 3 parts. Like they will have a stem, then there will be a lead-in question, and it will be followed by 5 options. And you should remember that this exam needs a very high score if you are planning to pass it. You should aim to get at least 70%. In the last exam, the pass percentage was set at 68%, which was very high. Before that, it was 66%. So you can see that all the time this number is just jumping up. And this is actually doable, but you have to work hard on it. The purpose of today's meeting is also to tell you that how you can maximize your score. Those people who are enrolled in the course, they know that they are doing previous past papers. Then we are doing our own questions, which are specifically made for developed for this exam. And then you can benefit from many other wonderful good books also. Like the previous candidates, they have passed using the same books. Like I would say Andrew Size's book is very good, and Andrew Size's new book for the part 2 MRCPI was published in the last year. It also has many good quality SBAs, so you need to go over them. Amanda is a good book, but that's a bit old now, so I will not ask you to go over that one. And then I will tell you that you should also go to this Rekha book, like it has plenty of the SBAs. And another good resource will be like our own Q bank, because it's not possible, like there are more than 10 books, so you are not going to cover all 10 books like that. So just do the stuff which you are able to revise in the 2 weeks before exam, because if it is very lengthy and you are unable to revise, then you are not going to get your results. So in the exam, I have mentioned before 100 SBAs. So go in a sequence, do one question and then click and go to the next one. So don't leave any question in between, and you should be very much careful that you are writing the right answer in the right place, because if you will mention it in the wrong place, then you are going to make mistake and you are not going to get any credit for it. If you are not happy about any of your answers, then my advice would be that since you have a sheet with you, okay, so on the left side, just write down the question number. In the previous for this computer format, they didn't have this option that if for example, if you're not happy about question number 15, that you should click on 15 and go back and answer. This provision was not available in the previous software. Now if they have updated, then I have no idea, because they have not informed anyone. So write that question number, that I'm not happy about this answer, this is my original answer and I will like to go back and check that one. So the problem with this exam is that you have done one question, you want to go back, you are now at 25 and you want to go to 15, so it means that you will have to click it backwards 10 times and then you will be able to reach that question. So that's why you should be very careful when you are answering the question, because you can waste your time also. And remember that total time is just going to be 3 hours, so you have to do it very carefully. Once you have reached the question number 100, after that there is one option, submit exam, submit answers. If you will submit your answers, then you will not be given a chance to go back and revise your answers. So be very careful, don't click on that button, okay? So if you want to go back to any questions, like you want to revise your answers, just go back to that question, and once you are sure that you have done it and you are happy about the answer, only then you should submit it. So exam is challenging, but people can do it. So from now onwards, I have good students with me, like who have been studying from like last year November, and it was not their intention to continue for that long. But the problem is that exam was not held, then they had no other option. So that's why then they had to continue. So they have been working well, but you know that no amount of time is enough. So because it doesn't matter that how well you have prepared, you will still have some potential points, potential pitfalls where you can face the problems. So my first advice is don't underestimate this exam. Now this is 1 month ago, so people who are going to follow their same strategy, but usually 6 months should be allowed. And every day you should plan to study between 4 to 6 hours. Even if you can study from 4 to 8 hours, then that's the best option. And then you should take like 1 or 2 days of study, because if you are continuously reading, then again your mind is stressed out and you won't be able to remember many things. When you are preparing like 3 months before the exam, 6 months before the exam, then you can study for 3 days and then take a day off. But if you are studying now, then I would say that you should study for 6 days in a row, and then you should stop for 1 day and then again start working for 6 days and then 1 day. So there can be many stresses, but my advice is that you are getting this chance to take the exam after a lot of struggle. So just try to focus on the exam and your healthy life, and rest of the things you should put them on the back burner. Otherwise, you are not going to get the results. You have to be consistent in your preparation. You have to be determined, because you know that you want to do it and you should achieve it. If you have friends who are taking exam with you and you can work in a group, that will be great, but the aim should be to help each other, not to criticize each other or like judge another one. that's not going to help. But if you are in the habit of studying alone, then this is not the time. This is not a drawback, so you can move forward. Study material, like those who are in the course, I told them categorically that they don't have to look anywhere else because all that you need to do is covered in the courses, in our online course. And here you have got those who are practicing with the exam, you know that you have got the PDFs and you have got video lessons, and then you have got the question bank, and then even the past papers, they are covered separately. And the notes, they are based on all RCPI guidelines, green top guidelines, NICE guidelines, SIFs, talks, and as anything which has good evidence, we are taking it up. And then the consent guidelines, good practice guidelines, everything is there. So at least at one place we are going to get everything. We have not removed the lectures from the previous lessons, like those people who took this exam in 2019, because that information is still valid. So some of the concepts have changed, like contraception guidelines, they were changed in 2019. So we have included the updates, and then the new recommendations as the new guidelines would come up. Like I will give you the example of maternal collapse. So we have introduced the new guideline. Then instrumental birth, uh, this one was also introduced in, I think, like 2 months ago. So we have just removed the older versions and we have put in the new guidelines. So this assisted vaginal birth, it has been added up. So that's how, you know, we have this quality control officer also. So we are regularly updating, and if some information is outdated, then we are going to remove it. So you should try to work on the same notes. Don't try to read any new notes at this time, because it is going to be counterproductive. And now in the next 1 month, I anticipate that you guys should be able to cover the course twice. First, you should do the reading in 20 days, and I'm going to post the plan in the WhatsApp group. So 20 days, and you should be able to cover it. And then in the next 8 days, you are going to cover the second revision. So that's all I will tell you about the exam. And then going back to the percentages, like the SPAs, I have told you that SPAs, they will have like 100 SPAs. Some of them will be pretty simple, some of them will be quite challenging. And but you should be confident, because all of these things are covered and you have read about them. And like I've told you, that you will get the single stem, you will have the one statement is there, one stem is there, then there is a lead-in question, and then after that you will have like 5 options. One option will be the best option related to that case, and other options, they will be partially correct, or they will be like one will be totally incorrect. So basically, it is sometimes it is very challenging to see that what exactly the question is asking you. Most of the questions, they are going to be very, very clear. Okay, so you will have to answer basically 2 type of questions. So what type of questions they will ask you? They call them K1 and K2 questions. So what are the K1s and what are the K2 questions? So like I've told you, the stem, the lead-in, and then the list of 5 options, which are all going to be correct, but some of them, they will be like more appropriate, relevant to the case. I will show you some courses. So some are K1 questions. K1 questions means that you don't have to interpret anything. You're just recalling the factual knowledge. Okay, that is K1. Just reproduce the facts. So mostly these questions will cover the topics like demographic findings, who is at the highest risk, what are the chances of survival, you know, all stuff like that. So these are called K1 questions. Then you are going to, but the more questions, they will be of K2 type. K2 type questions means that you have to recall and you have to apply your reasoning skill. So the question is going to be practical, related to the 100% relevant to the OB-GYN, but this is the applied knowledge. So for this, you need critical reasoning skills. Critical reasoning skill means that you have to see why this question is right and why another question is not correct, why another option is not correct. So applied knowledge, so how you can acquire it? By critical thinking. So like you have been practicing with the questions, so you should be able to answer the questions. point is that many options, they will be very attractive and they will be relevant to your subject. But the point is that you have to read the case, what exactly they are asking, and then go and choose the most relevant application on STEM, which is most relevant to your patient. Because in a specific atmosphere, just one option can be correct. Other options, they will be incorrect. So how you can get the questions right? I'll tell you in a bit. This is K1 question. Like a woman who is Rh negative, she undergoes amniocentesis at 16 weeks. So what dose of anti-D immunoglobulin should she receive immediately after the procedure? So you know that this is less than 20 weeks. So she's going to get 250 international units. Then you should know that all of these options, these are correct, but not relevant to this case. Because if you will recall the guideline of RCPI on NPD administration, we read that the maximum dose we can give is 15,000 international units, and then we should give that like every 6 hourly, and then we have to check the patient also that she is not having any other problem at that time. So we have to divide the dose. We cannot give that much massive dose in just one instance. Okay, 15,000 international units cannot be given together. This next question, what are the presenting diameters? Which is the presenting diameter of this fetus? To look at this one, that like this is an example of K2. Like you have 28-year-old primary gravidine spontaneous labor, and the head is 0.5 palpable per abdomen. Abdomen cervix is 7 centimeters. Cephalic presentation -1 station. Anterior fontanelle is palpable with orbital bridges, and the nasal bridge, which is felt anteriorly. So nasal bridge, you are feeling anteriorly. So what do you think? What is the position of this one? So you're going to apply your knowledge. Root of nose is there, like that. So first here you need to think that this is a face presentation or this is brow presentation. So you are able to feel the orbital ridges also. So this is your clue that this baby is having brow presentation. So you have applied the knowledge. This is brow presentation, then you will go back and you will look for it that in brow presentation, what is the diameter? Because in face presentation, you should be able to face the tip of nose or this one, but you will not feel, or you will face the tip of the nose or the chin you will feel, but you will not feel the orbital ridges. So that's why you are forced to think, and then you have reached that maybe this is a case of brow presentation. So then the question arises, what is the diameter in cases of brow presentation? So this is the second form or the applied form or the K2 form. So that's how you know they are going to set up the questions K1, K2, and then you know you are going to apply your knowledge in 2 steps, and then you are going to find out the correct answer. So mento-vertical, if I will ask you, if the baby is in mento-vertical presentation, what will be the diameter? Okay, think about it. That's what is involved, the critical thinking, that you are just knowing the diameters and then you're applying the knowledge, and then you will apply your knowledge at the third step that this baby is in brow presentation. So it is not possible to deliver that, and she's 7 centimeters. It is palpable like that, but because of the brow presentation, maybe I will have to go for cesarean section if she doesn't progress like that. Then look at these other questions here. You are just recalling your knowledge. Like this woman has BMI of 26. She's here for VBAC. So which is the best predictor of the successful VBAC? So immediately all aspects of the VBAC, they should come to your mind, that in which conditions you can allow your patient to go for normal birth, and where you should abandon VBAC and you should go for cesarean section. So if you will look at the factors that the successful VBAC, it can be predicted if the woman is of low BMI, she's a younger woman, and then shorter inter-pregnancy interval. This is associated. This is just the opposite. This is associated with high chances of failure of the VBAC. Spontaneous onset of labor, yes, it's a good sign, but it is not going to predict that the VBAC is going to be successful or not. So previous vaginal birth, that is the most important predictor that she is going to have a normal birth like that. So that is K2 because you are going to apply your knowledge. So look at this question. This is also a single best answer, but this is just testing your knowledge. So here you are going to recall, like this question is asking you that 21-year-old woman for preconception care diagnosed with generalized tonic-clonic epilepsy 4 years ago, poorly controlled, and she's currently on sodium valproate and levetiracetam. So what is the next step in the management? MRI, EEG, aspirin, these are not indicated, but you should review medications, which you are going to do. But she is attempting, so you need to give her folic acid. That is going to be the first step. Because here also you are thinking in two steps. Sodium valproate, there is strong recommendation from NICE that it should not be given to the women of reproductive age group. So that's why you should not give it to her. And if she will become pregnant when she is on sodium valproate, so it means that she is going to develop other problems like she can have neural tube defect. So of course we are going to review the medicines. We will have to arrange EEG to see if she is having like uncontrolled activity and the seizures are uncontrolled. They are telling that this is poorly controlled. So poorly controlled, so you have to think logically. You cannot stop the drug immediately. You need to give her an alternative. Maybe you will have to taper it off, and the neurophysician is going to change the drugs. You are not going to review her medicines. The one who is going to change is the neurophysician. So from the OBGYN perspective, you need to commence this 5 milligram folic acid to decrease her risk of developing neural tube defect. So these questions in the exam, they are set up by a team of experts, and they are well prepared, trained to answer, to set up these questions, and they are important. So don't think that like these are simple questions and we cannot do like they're not going to repeat the exam. The good thing is that they are going to repeat many questions. So that is good thing. Like in one exam we calculated before, they asked like 30 questions were from the previous exam questions. So like I will show you the example, like many different types of questions can be there, and just remember that these are only recalls. So the full questions are not given here, but this is nice of the people, like they have given you the question. So in most of the questions, what are you going to get? Like you will have to make decisions, and you will have incomplete information. Either it is not given on purpose, or we don't know much about the condition. Like I will give you this information, like 15-year-old has come to you with boyfriend. So they will give you the age of the boyfriend also. Why it is important? It is important because you should tell them that what type of contraception is safe for this girl. And the question can be like, she is 15, so she should be allowed to decide or not. Again, you will have to decide that she is fulfilling the components of Fraser's competence, Fraser guideline, and then you're going to give her contraception. Then in some cases, you will have to think like very on two steps, like 20-year-old, low BMI, she is runner, she has light periods now, and 8 months ago they have stopped. So many students, they will say that this is just like she has developed amenorrhea, so she's going to be menopausal. While those who understand the mechanism, that she's 20, low BMI, runner, intense exercise, so her GnRH is going to be very low. So she has this amenorrhea of hypothalamic hypogonadism type. So before starting any other treatment, we need to give her, restore her body weight, modify her this running routine, and then she's going to be fine. And her period, they didn't abolish immediately. They have slightly disappeared. First they were light, and then now they have disappeared. So that is the point. So you are going to get questions from all modules. It is not like from one module you are going to get full questions and then nothing from another module. This is not the case. You are going to get many things from each and every module. And like I've told you that all modules, they are just like the MRCOG modules, and the only problem is that people don't know about them, that they have been divided into the same modules like any other thing, like genital tract trauma, like the gynae surgery, the surgical procedures. So if I will tell you that what type of questions they are asking, so you should expect that now on normal pregnancy, you should expect to find like 8 to 12 questions. They can be on the antenatal care, on the fetal medicine, maternal medicine, anything can be there. Then you should expect like 4 to 6 questions on the postpartum care, complications, breastfeeding. Abnormalities in the pregnancy, like 10 to 15 questions. Then general health and the well-being of the woman, 4 to 8 questions. Then medical and surgical disorders in pregnancy, 16 to 22 questions are usually from there. And this area is very heavily tested. And even you can see in the curriculum given by the RCPI, you can see that maternal medicine, hypertension, renal disease, cardiac disease, liver disease, hepatitis, respiratory disease, GIT disease, diabetes, endocrine, neurological disease, where we will cover epilepsy, hematological disorders, connective tissue disease like SLE, autoimmune disorders, skin disease, medical disorders on the liver ward, and addiction, important area. All of these are covered here. Okay? That is the point. So you need to cover everything. Prenatal diagnosis and management, and when you should offer some intervention, and these are important. How you should monitor the baby in the intrapartum period, and how the baby should be seen immediately after birth. You are going to get like 5 to 8 questions from here. Urogynecology and the pelvic floor disorders, like the pelvic floor, well, like this pelvic organ prolapse, important area, and you are going to get like many questions from here. You can see that how many things have been covered here, like surgery for the stress, then how you should carry out different procedures, how you will manage this vaginal hysterectomy, anterior repair, posterior repair, how you will manage this urinary incontinence, fistula, prolapse, how you're going to carry out different procedures, what in the OB-GYN. So all of these questions are important, and you should expect to answer like 3 to 8 questions will be only on urogynecology and prolapse. Infertility, reproductive endocrinology, like 12 questions, and it's a huge module. It is going to cover it is going to cover the disorders in the sexual differentiation, like we have done. I think we have done an extensive module on reproductive medicine, in which we covered disorders of sexual development, then what are the basics of normal fertility and the subfertility, and what are the different types of infertility, including the male and female unexplained. Then how we can assess the infertile male, how you can assess infertile female, how we can help them with medical treatments for controlled ovarian stimulation, which patients will need ART, assisted reproductive techniques, and among the techniques, who will go for IUI, ICSI, IVF, and then what are the special challenges of such techniques like ovarian hyperstimulation syndrome, causes of anovulation like PCOS, and the premature menopause, premature this ovarian insufficiency. All of these things you should know them very well. Then benign gynecological conditions, like this module is very common, very important. So they are going to ask you several questions from here. Menstrual disorders, infections in gynecology, ulcers, all of these things are covered here. Like anything which is not covered in urogyne, onco, in infertility, and in contraception, that is covered in the general gynecology. Core surgical skill, you should know about the indications, contraindications of other procedures, and how you will do them, what are the complications, how you will take consent from the patient. So such questions are going to be like, you are going to get at least 10 questions on the operative procedures, that choose the most appropriate procedure, consult the patient, what test we would like to guide the patient on, consent on that one. Malignancies are very important. You should know about the benign diseases, and you should know about the pre-malignant disorders, and then you should know about the malignant disorders. You should expect to answer like 15 to 20 questions on these modules, and they will cover the cervical screening program. Then you should know that though they are following the same guidelines as the NHS, but for the classification, they are using Bethesda system like ACUS, LSIL, HSIL. Now the RCOG is also recommending to use the same terminology. Then if you remember in oncology, we have just covered all of these conditions and the updates. So it should not be a problem for you. No, cover your germ cell tumors. You are going to get many questions from there. What will be the typical appearance of the tumor? What are the tumor markers? In which age group you are going to see certain type of cancers or the germ cell tumors? How you are going to identify them? How you are going to manage them? How many of them are going to be unilateral or multilateral? This is all very important for you. Consent guidelines are very important. You are going to get like maybe 5 questions on the consent guidelines. So these are very important for you. Contraception, yes, 4 or 5 questions, especially when to start a type of contraception, when to stop that, and how to provide postpartum contraception, then contraception in certain specific conditions. So all of these things should be on your fingertips like that. So these should be there. Then in the general gynecology, you are going to get many challenging questions also, like in cases of sexual assault, rape, what basic steps are important. Okay. Then acute pelvic pain, dysmenorrhea, then recurrent miscarriages, ectopic pregnancy. You're always getting like 3 or 4 questions. Female genital mutilation. If you look at these contents, then you should be sure that they have been taken from the RCPI guideline. You can see here, this is the RCPI manual, and everything has been taken from the OB-GYN curriculum. So that's all you have to cover. Like there is nothing that you can leave. Many students, they ask me that what about the obstetric emergencies? Yeah, they are going to get plenty of questions from here. People think that the Irish exam is not testing their knowledge of ethics and biostatistics. So they are testing basically the basic statistics and ethical principles. So you should know about the risk management, you should know about audit, clinical governance aspect. So all of these things are required. In the maternal mortality report, you are going to cover everything. You can see here that this one also I have taken from the book. Ethics are very important. You should understand the questions. You should be able to be honest, have open discussion, transparency. Mistakes can be there, but you should identify them, know about the clinical triggers. And then patient safety is very heavily tested. You have to rely on them. You should be well prepared to answer all questions on them. So the WHO safety rules and all of the stuff should be there. Regarding biostatistics, you are supposed to cover some topics like what is maternal mortality, what is maternal mortality ratio, what is neonatal birth rate, what is neonatal death rate. All of these things you should know. What is considered stillbirth, what is considered an abortion, when you will say that this is a live birth, under which conditions you can offer termination of pregnancy. Now you know that it has been made legal in the RCPI that you can offer termination, but it is not like open-ended question, open-ended like you can do it for everyone. There are very specific indications for it. So don't think that it is doable for everyone. So that is not the case. Okay. So you know the conditions very well. And I have seen the students, why do they fail? That is very important. The number one reason for failure is that they are not well prepared. There is no substitute to good preparation. So you have to spend your time, you have to do some efforts. And I won't say that every day you should be reading 100 pages. Everyone is learning at a different pace. But if you know the pathway, then the things they become easy for you. You should always take help because now the medicine has become very competitive. So you should just read the stuff which is really essential and going to increase your score. If there is something which is not going to increase your score, you are not supposed to do that. Don't go for that one because it is going to waste your time. So value your time, don't waste that. And prepare very well. Then half of your time, like if you're studying for 4 hours every day, for 2 hours you should be reading the textbooks, and for 2 hours you should be doing the questions. Doing the questions is equally important. So first I have given you the distribution of questions according to the topics, but now I'm going to tell you that how the questions are distributed. Like management is very heavily tested. In management, basically we include history, investigations, diagnosis, and then how do you carry it out. Specific management 15%, investigations like 18%, like you have to interpret the results or you have to request the basic investigations. And how you will, and sometimes they have given you the diagnosis, they have given you the lab results, and you are going to decide about the you have to decide the diagnosis. So 13 questions will be like that. Natural history of the disease, that who is likely to develop a certain disorder, that you are going to see in 5%. Basic sciences, you should expect to answer like 4 to 6 questions, like which structure is supporting the uterus, and so what is the nerve supply, what is the lymphatic drainage. These things you should know, and I think before when you are doing this ANPO, we have been talking about it. General gynecology like 12%, general OB like 18%, research, teaching, and biostats, you can see 15 questions. So all of these things can be there. Infertility, again, just specific to the male or female infertility, few questions, but when you will talk about other topics like PCOS, ovarian hyperstimulation, controlled ovarian stimulation, how you're going to provide the doses, then this number will increase. What resources you are going to use, and oncology at least 8%, benign conditions 8%. Again, I will say that the important resources are RCOG guidelines, RCPI guidelines, NICE, clinical governance. So then you should remember like 30 to 35 questions, they will be from the recalls. So don't forget to do the old questions. I'm not telling you that you should just learn those questions. That is not the way forward. But you should know about these topics because they are very important. That's why they have been included in the exam. And you don't have to read any textbooks because they are just going to waste your time. So don't do that. Just go to the college website, do the latest guidelines. And main points which are given in the guidelines, algorithms, and the tables, we need to do that. Like I remember that we collected many algorithms and that from the college guidelines. So just stick to them, make it a point to read all of them in the last 2 days before the exam. Previous questions, do them at least twice because they are going to be very helpful. So if you have any question, please ask me now. So if you have taken the exam, then you should have to wait for like 10 days to get your raw score. They will tell you that where do you stand, and then for the definite score and the scorecard, you have to wait for 2 weeks. And after that, the new journey will start. That is that you will have to wait, apply and wait for the OSCE exam. For that also, you have to follow different format and different techniques. So regarding this orientation, that's all I have to say. If you have any questions, you are most welcome to ask us, or you can drop email, or you can ask in the WhatsApp group. So all the best for you. You still have plenty of time, and trust me, you can do it, but don't start anything new at this stage. Just try your best and try to complete your exam. And of course, I wish you all the best. Thank you very much.